Nurse practitioner versus physician assistant. Which one is right for you? Hi friends, welcome back to my channel. If you are new here, my name is Gail. I'm a family nurse practitioner and nursing educator, but also a mentor for future nurses and advanced practice providers. Maybe you are in nursing school thinking about grad school, or maybe you are switching career and wondering which path fits your goals, right? NP or PA? I've got you covered. We are going to talk about education, scope of practice, job outlook, salary, autonomy, but also lifestyle. Everything will be in this video, and I'm also gonna share my honest perspective as a nurse practitioner. So let's break it all down. Let's start with education, because this is one of the first major difference. To become a nurse practitioner, you must first become a registered nurse. Okay, that means completing either an associate or bachelor degree in nursing, passing the NCLEX RN, and working as a nurse. After all that, then you apply to a graduate level NP program, either a master degree or DNP, a doctor of nursing practice. NP programs usually takes about 2 to 3 years. Some students go part-time while working as nurses, because you have to still provide for yourself. Others go full-time to finish faster. During school, you complete coursework and hundreds of hours of clinical rotation, which you often have to find yourself. We'll talk about it later. We all know the profession as physician assistant, PA. To become a PA, you don't need to become a nurse first, okay? Most PA have a bachelor degree in biology or health science and experience working in healthcare. So like as an EMT, a paramedic, or a medical assistant, okay? So then after having those experience, then you apply to a PA program. So the PA program usually takes about 2 to 2.5 years, full-time and very rigorous. Okay, so PA school is modeled after the medical school with a heavy focus on diagnosis and diseases. So NP nursing model, so must be a nurse first. But PA medical model, no nursing required. Both NPs and PAs are considered advanced practice providers. That means we can all assess patients, order lab and test, also prescribe medication, manage chronic and acute conditions as well. But our training models are very different. Nurse practitioner use nursing model. We focus on holistic care, prevention, patient education, and long-term management, while physician assistant, they use a medical model, which is more disease-centered and aligns closely with how physicians are trained. One major difference is autonomy. Nurse practitioner can practice independently in many states. This means we can open our own practice without physician supervision. So we can sign on our own medications. We don't need anybody else but us. Okay, but PA, physician assistant, typically, they practice under supervision of a physician. The level of oversight varies based on the state and the employer, but PA means body with the physician. If independence is something you value, that might factor into your decision. So now let's talk about clinicals. Here's where I get really honest. In NP school, you are often responsible for finding your own preceptors, and this is something no one really talks about, right? When you apply, they all want to sell you that dream of apply for FNP, you become an NP in 16 months or whatever, but the recruiter might say during the admission process that will help you, or like will provide you with a list, but in reality it's up to you, and it can be very difficult and stressing. So you spend hours emailing clinics, calling clinics, networking, and sometimes even paying third-party services just to secure a clinical rotation. So this one is the biggest stressors for NP students. You hear about it, you see on social media, it's really not good. So I've seen students delay graduation just because they couldn't find a preceptor. So that's how bad it can be. In contrast, PA programs typically provide clinical placement for the students. They rotate to a variety specialty like surgery, emergency medicine, internal medicine, pediatrics, and more. So that's definitely a big advantage of PA route. Once you graduate, the next step is certification and licensure. For NPs, you take a national board exam either to ANP or ANCC, depending on your specialty. And then you apply for a state licensure, and depending on the state, you might need to apply for prescriptive authority and DEA licensing separately. So, but PA takes the PANCE, PANCE, the Physician Assistant National Certifying Exam. Then apply for a licensure through the state board as well. They also need a supervising physician agreement in most states to practice. Let's talk about the job market. Both NPs and PAs are high in demand. The healthcare system needs both NPs and PA, especially in primary care, urgent care, telehealth, psych, or even rural health. But getting your first job can still be challenging. Many employers want someone with experience, so it helps to do some clinicals in places that will eventually hire you. When you're in clinical, network. Just take a phone. And just like NP school, no one really tells you how hard it might be to get that first job. You might send out a dozen of resumes, go weeks without even hearing back, or feel like you are stuck. You need experience to get hired, but you need to get hired to gain experience. But also one thing I've noticed is, that's personal, but I feel like many practice or many private or physician office tend to hire more PAs just because it's the same model, so they kind of know how to work with them. I've been in places where I was asked, okay, you were NP, how can we use you in our practice? So you do a lot of teaching when you're in NP, because most of those physicians, especially the older populations, like the older ones, they really don't know how to use NP. So if you want the job, you kind of have to explain to them that they use you as a provider. We're not PAs, but we both advanced practice providers. See what I mean? Now let's talk about money. Let's talk about money. PA's salary is slightly higher than NP. So it depends a lot on location, specialty, but also the experience. Specialty like dermatology, orthopedic, psych, emergency medicine, they tend to pay a lot more. So for both NP and PA, actually, primary care and women's health tends to be on the lower paying. And guess what I did? Primary care. Okay, primary care and women's health, even though they may pay at the lowest end, but they may offer better work-life balance. Speaking of balance, this depends a lot on your job setting. So some NPs and PAs work 9 to 5, Monday to Friday. Others work 12-hour shifts, weekends, or are on call. So if you work in the urgent care, chances are that you'll be working 12-hour shift. And if you work in an office or doctor office, you'll be doing 9 to 5 if you are full-time. So you can make your own schedule at some jobs. It just depends on your settings and where you choose to work. But once you get experience, you can hopefully negotiate your contract and switch some things up. The big question is, which one is right for you? Choose NP if you are already a nurse and want to build on your current experience. Choose NP if you are passionate about patient education, prevention, and also holistic care. Choose NP if you want the best options to work independently and possibly open your own practice someday. Choose PA if you are coming from a non-nursing background. Choose PA if you want a more structured medical model education with guaranteed clinical placement. But some NP schools also have guaranteed clinical placement. Don't choose based on clinical placement, and choose PA if you are comfortable working under physician supervision and want a broader specialty training up front. PA will train you in the ER, in the urgent care, in all those specialties, but NPs are more limited to primary care or NICU or women's health. Both are excellent options, but it comes down to your background, your values, and your long-term goals. So at the end of the day, both nurse practitioner and PA are making huge impact in healthcare. We need both. And no matter which path you choose, it will be challenging, fulfilling, and worth it. If this video helped you, don't forget to give this a thumbs up, subscribe, and drop a comment below with your thought and question. Thank you so much for watching, and I'll see you guys in my next video. Bye.